Hi, Dr. Olivier. Thank you so much for joining me today. I just wanted to first ask you about what made you interested in going into medicine.
Wow. Well, from a very young age, I always knew that I wanted to be a physician. And I think that's perhaps because I know my mom was a nurse and my father was in technology or in the lab actually at the time. And I think that influenced me being the oldest child. I knew I wanted to be in medicine, but I didn't know I wanted to be in ophthalmology. And that certainly evolved over time. When I was in medical school, and one of my classmates said to me, I was doing a talk on diabetes, and it was the very last third year, last rotation, internal medicine, and his father was an ophthalmologist, and he said, do you want to use some of my slides? I said, sure, right, whatever. And I looked at them, and it was so amazing and exciting. I said, I either want to do that or OB. So my dean was like, oh my gosh, but as I thought about it, you could do medicine and surgery. You have patients for a very long time, and I really enjoyed the fact, as I do now with my glaucoma patients, knowing them over very many months and many years. And when I got into ophthalmology, I have to credit Dr. Eve Higginbotham. In fact, today, as we're recording this, she just gave a talk here at Vanderbilt. And it was her who sort of said, what do you want to do in ophthalmology? And I thought, cornea. She's like, oh, glaucoma needs you. And really it was true. As an African American, it affects a lot more blacks than it does whites. And my background is also that my parents are from Haiti, and in Haiti I see glaucoma affecting a lot of young people. And as time has evolved, and as she said, the house of medicine, I've learned that there are many things that one can do. But that's how I got interested in ophthalmology and in medicine.
Did you face any obstacles that were difficult to overcome trying to get to your goal?
So obstacles in my goal, I'd have to say, initially not really. I think that I was blessed in that because my parents were immigrants and they came here, we went to good schools, education. I have to say because perhaps my parents were from the Caribbean, that people accepted us a little differently. I spoke French, spoke more than one language. And so very often I was the only black in the class. Certainly, there probably it was at some time, some racism. I remember as a young person working at the bank as my first job, and almost my only job really besides medicine, people saying, I don't want to see her, but didn't really impact my life. I think I had a good sense of self and what I was worth, and it went through. I have to say that probably very recently, as I was in academic medicine, and I had been an assistant professor, sort of going to that associate professor level, being in a department, I found that I, for the first time, had really encountered racism in terms of, as a woman, as a black woman, not really given the promotional opportunities of my other colleagues. But I fought back and really won and stayed where I was. But I think that was really the first time I said, wow, whoa. And I thought that it's very important to give guidance and mentor people. And but I've been blessed. It hasn't been some of the roads. But I know for my patients, I can see a lot of those obstacles sometimes where I work, where I am in the community, how other people treat them. And I feel that I have to fight for those patients, especially at a place where I work in sometimes a county hospital, that we really treat those patients like I do in my private practice.
I know that you are very well accomplished in ophthalmology, and you have a lot of leadership roles, like you're the president in the Women in Ophthalmology group, and now you've been called the Associate Dean in Chicago at that university for diversity. And I wonder, given that you obviously are interested in diversification in medicine, what your goals or thoughts are with regards to diversifying medicine, ophthalmology, and why it's important to have students of color or students of different backgrounds in medicine.
Wow. I certainly have had a lot of leadership roles in the fact that it's women, right, with president of Women in Ophthalmology. And I would say for women, it's so important. We now are 50% of the women are in medical school, but they're not chairs of departments. They're not full professors. They don't always have tenure. So I think that's important to continue to teach negotiation skills. And I think that's really what Women in Ophthalmology tries to do, build a resource center so we could find places to let women know they could put their CVs on. I'm really sort of sick and tired, frankly, of seeing these huge meetings and you have 99% men on a panel. Maybe you have several women. There are lots of women out there who are very accomplished and can be a moderator, can be on the panel. I mean, recently I saw a panel of young ophthalmologists, again, mostly men, where 50%, even almost within the academy, we have, women going into ophthalmology residencies. So I think not acceptable. We certainly have to raise the bar. So I think in terms of women, that's one thing. And when you have women, more women who are part of the system, and I'll say the same in terms of diverse populations, what you have are people bringing different ideas to the plan. And so you end up building a better shoe like Nike, a better healthcare system. So I think that's important. And so as it is important as I'm the Assistant Dean for Diversity at the Rosalind Franklin University of Medicine and Science at the Chicago Medical School. And again, underrepresented minorities, very important to medicine, because when we look at the population and what it's going to be like over the next several decades, it's going to be blacks and Hispanics. And we have to have a workforce that represents the population by which we're going to have. And most importantly, people understanding cultural competency, the language barriers, that there are a lot of Hispanics with perhaps they don't even speak a second language like English, or they speak better in their language. And so there's too many misinterpretations that can happen if somebody doesn't understand or picks the wrong word. And so what happens is perhaps there's a problem and they didn't take their medications correctly, and now we have morbidity or mortality. So I think those are so important, but it is so hard to infuse that. I mean, I am a member of the AMA and I represent the American Academy of Ophthalmology, and in the House of the Delegates of the AMA, there's not a lot of diversity. Now, there is so much more than there was before. There are 70 more underrepresented minorities that are there, but we cannot make the changes that we need to make and understand that. Even in the AMA, the Women's Physicians Congress just became a section so we could have a vote. And we just got our third woman president. We've had one black president, male, of the AMA, no black female president of the AMA. So, you look at those things, and even our academy, who is doing great strides. I mean, I'm on the board of trustees. Tamara Fountain is on the board of trustees. Eve Higginbotham was on the board of trustees. Keith Carter was on the board of trustees. But yet we've not had a black or Hispanic president of the American Academy of Ophthalmology. I think those things will happen. But what happens is, if you can infuse more people into it, then of course, you could do something about it. And what does that mean? I mean, at the medical school, we're looking at holistic ways of looking at applicants coming in. What kind of student do we want to come to the school? We said, okay, maybe you're from a rural area. Maybe you're from an underserved area. Maybe you're the first person in your family to think that you even want to become a doctor. And we all have barriers, right, of people telling us not to go to medicine, or when you're in medicine, don't become a neurosurgeon. Don't become an ophthalmologist. I think you have to think, what? As black people, as Hispanic people, we need people like us to be in those specialized specialties. So I think that's important. So we look at the holistic matter. Did you have something that happened in your life that made it difficult for you to either get through medical college so that you want to come to medical school. All of those things. Maybe you took some time off and you had to work. Maybe you had to work while you were in college and go to to school, and that really affects you. So all of those things, what kind of student do we want? Compassionate, somebody who's not arrogant. And so all of those things will come into a pool now where we can see, are you a leader in your community? Have you done things, maybe you started a non-for-profit organization. Maybe there's just something else that's different about you that we think you could really become a great physician. And I think that allows us to be able to start now picking the types of people that we want to be doctors. It's not always the person who has a 4.0, who's got the great MCAT score, who's done all that research. Maybe that person is better in a lab than they are really taking care of patients in the community, because most of the time we go to the community. And so that's one of the ways now, as an assistant dean for diversity, I can hopefully help in that process. And then minority faculty, right? I mean, now you have more minorities going into medical school, but you want to be able to see the faculty reflects who you are. You want mentors that are like you, who may understand sometimes the struggle that you went to, and that's really important. So we have to get minority faculty, and then we have to retain them. It's not enough that you're only the one person or two people. In fact, I always say you almost need three people in one category, because you have different ideas, diversification of ideas, and it's important. And I think for ophthalmology, it's important as well to diversify ourselves, and we just have not been in large numbers in ophthalmology, and we need to be, because the future suggests that we're going to need more workforce and diversity, and so we have to be able to get more blacks into ophthalmology.
Give me one quote that you could tell me if I was a 15-year-old, bright-eyed, ready to go into something, but wasn't really sure what I wanted to do. Give me some advice. How can you direct me to help me know that medicine is the right choice for me?
If you're a young person, I think shadowing somebody is always great. But I would say, because there are always medical centers and medical schools around, find a center around your area, reach out to the medical school, let them know that you're interested. There are always programs. Maybe you could go visit the medical school. Maybe you could sit into a medical class, and they can really connect you. And maybe you could do a little research project with somebody there, and that would really start to help you to understand whether you want to do medicine. One thing is for sure, whatever you do in life, you have to have the passion for doing it, and that's important. So if you want to do medicine, you should certainly reach out to somebody. And what's great about being in medicine is you could be a teacher, you could be an educator, you can write policies. And, I'm involved in AMA, and the American Academy of Ophthalmology has organized institutions. There's so many things you could do within medicine that it just becomes a really great career choice.
Thank you so much, Dr. Olivier, for your time. You are certainly a role model that all of us want to follow. Thank you.
Follow your own path. Thank you very much.